how to record it. There we go. So you guys can all view it after if you want as well. Okay, so let's get started here. Thanks for joining me on a Friday afternoon. Grab a beverage, grab a tea, grab something. Let's have some fun learning about the shoulder here. So how do I share this? Beautiful. Everybody should see a PowerPoint. Is that what everybody's seeing right now? Perfect. Okay, so let me bring this all the way up. Sweet. Understanding the shoulder. The reason why I called this webinar Understanding the Shoulder, because I think in order to truly work through shoulder injuries and kind of improve your shoulder mobility, you need to understand the mechanics, you need to understand the anatomy. Basically, if you can understand the relevant tissue, meaning muscles, ligaments, bones, and everything, and how the structures move, you can plan your own rehab for a lot of what's going on with shoulder injuries, barring any major acute trauma. So this is me, a bit of an intro for those of you who aren't as familiar with me. I am a chiropractor by trade. I've done additional training in neurofunctional acupuncture. I am a functional range release provider. A massive nerd with my third research publication in inflammatory diseases of the spine coming out hopefully in the summer, which is exciting. And then amateur exercise racer, so a couple triathlons and a CrossFit competition coming up this summer. Probably won't happen now due to the COVID situation, but such is life. So outcomes. Our main outcomes right now are going to be understanding the relevant anatomy, understanding basic mechanics, what is mobility, what is flexibility, and then how to improve and maintain ranges of motion at the shoulder joint. So starting off with the kind of bony structure here, this right here is what we're looking at is an anterior view of the skeleton, meaning from the front. This is a posterior view of the skeleton, meaning from the back. The first thing that you're going to notice here is that the shoulder blade itself kind of sits along the rib cage. Oh, what's going on? Sorry, just one second, guys. Here, I'm getting some notifications from the chat. Just want to make sure everything's okay here. Will the PowerPoint be available? Oh, yeah, I am recording it, Jordan, no problem. Sorry about that, guys. Let me see if I can close this. All right, and we're back. Okay, so understanding the relevant anatomy, you're gonna notice here that the shoulder joint itself, the only reason that it's connected to the upper limb is through this joint right here, which is called the sternoclavicular joint. Otherwise, your arm is free floating. So that's where the importance of the surrounding muscles come into play. Because if it wasn't for this joint right here and all the muscles around here, your arm would just be in dead space. Okay. I'm going to go on to the next slide here, and we're going to get into a little bit more of the anatomy. So what I'm going to do is I'm going to share a different screen with you guys. And do you guys see a skeleton now? Yep. Okay, so we're going to just walk through some of the anatomy in a 3D model here. This is the humerus, also known as the arm. The head of the humerus here is what's going to form the actual ball and socket joint with the scapula. Now, this little socket green in here is called the glenoid cavity, and this is exactly what it is. It's a socket for that ball to rest on. It's not very shallow. If we dive down and look at the hip, you're going to see that there's a lot more coverage in the hip joint here. So the lack of coverage in the shoulder is really owing to its large degree of range of motion, the fact that we can move it in so many directions. This little bone here is the clavicle, and this is where that sternoclavicular joint is. This is the only reason, aside from the muscles, that your arm is attached to the rest of your body. This forms a very important joint out here. This is called the acromioclavicular joint. This little nub on the shoulder blade is called the acromion, and you have a set of tendons that run underneath here, and those can be pinched, sometimes called impingement syndrome or subacromial impingement, and that's where you can get a whole host of shoulder problems and pain and ouchies coming about. So this is a very relevant structure here. Now we add on some other stuff, And now we see these gray bags. These gray bags here are ligaments and capsules that surround the joint, almost like a grocery bag. So if we have our ball and socket, it's all enveloped by this capsule and ligaments to help give it more structure. And let's see here. Okay, and we should be back to the PowerPoint now. In terms of the rotator cuff, if you guys aren't familiar with it, it's made up of 4 muscles: subscapularis, supraspinatus, infraspinatus, and teres minor. You can see these are the insertions of the rotator cuff. They form a little socket around the actual head of that humerus. And the 5th rotator cuff that I always like to point out is the biceps. The biceps tendon is going to travel all the way up and around the top of the shoulder here. So a lot of times when people have superior or anterior shoulder pain, it could be this tendon from the biceps. So even though it's not typically classified as part of the rotator cuff, I like to classify it as the rotator cuff. Another thing that we can see here with the anatomy is this muscle here on the front is called the external oblique. Now, this muscle is going to eventually have connections into this other muscle here that you see, which look like little slips. That's called serratus anterior. And these 2 muscles are essentially going to be 2 in 1. Now, this is really important when we think about the core. And a lot of times with shoulder patients, I start out working with the core rather than specifically at the shoulder. And this is the reason why, because there's a large connection between the core and the shoulder, because you have to have a strong core and a stable core to allow your shoulder to move properly. Doing okay so far, everybody? So these are some basic ranges of motion of the shoulder. The first one we have is shoulder flexion, which is going all the way up overhead. Extension is going all the way down and behind our body. Now, these 2, everybody gets a little confused at the start. We have adduction and abduction. The easiest way to remember it is that adduction is 2 Ds, and you're adding the limb closer to your body. So if my arm is here and I bring it down towards my trunk, that's adduction. If I bring it away, I'm abducting it, okay? Internal rotation is pretty simple. We're just going in. External rotation, we're going out. They're all opposites, okay? That can be done in this position, basically any time that you're having rotation at that shoulder joint, that's when we're going to be dealing with either internal or external rotation. Now we come to something called the scapulohumeral rhythm. And I know it sounds scary and there's degrees and numbers and stuff, but let me break it down and make it really simple, because this is a very, very key concept in terms of anatomy. So as your shoulder blade, or as your arm comes up into the air, your shoulder blade cannot be fixed. So your shoulder blade is going to have to rotate to allow that socket to be nicely positioned for that arm, okay? So if you're bringing your arm up and that socket's here, and your arm goes up but that socket doesn't travel with it, that's where when we're going to have a problem. As such, you need to have that socket rotating upward with your arm at the same time. So phase 1 of scapulohumeral rhythm is from when the arm is right up against the body to when the arm is out to 30 degrees. So in this first 30 degrees, all we're going to have is just the arm moving. The shoulder blade is going to stay relatively positioned where it is. Phase 2 is from 30 degrees to 90. So once we get out from 30 degrees here up to 90, bike's in the way, that range right there is phase 2. In that motion, we're going to have abduction at the humerus, which is this motion. Then the actual shoulder blade is going to have to rotate upwards by about 20 degrees. And interestingly, then the clavicle is also going to have to elevate by about 10 degrees. So you see how there's a lot of moving parts. It's essentially what I'm trying to show you here. And then phase 3, what's going to happen is that's going to be accentuated even further. So that arm is going to continue going up and that socket has to continue to rotate upwards with it. Now you can imagine what's going to happen if that arm keeps coming up and then that arm stops because that socket doesn't travel with it. That's where we start to get those impingement issues and those other hosts of shoulder issues in terms of movement-related conditions at the shoulder. The clavicle we've talked about a little bit. It's a very, very important structure in the shoulder because as your arm comes up, that needs to elevate to allow your arm that freedom of motion. The other thing the clavicle does that everybody kind of gets confused about is it actually rotates. So when you bring that arm up into the air, your clavicle, your collarbone, is going to tilt backwards like this. And the reason why is because if it didn't do that, again, you hit a wall and you wouldn't get that full range of motion. So it's really, really important that you screen your patients, or if you're working with athletes, that you look to see if they're actually moving about through the clavicle, and you should be able to feel some rotation through there. This is more applicable. We have some chiropractors and some chiropractic students with us. So this is a clinical pearl. Subclavius, it's a muscle that sits underneath the collarbone, this little slip of green here, and it's going to depress. So it's going to pull the collarbone down. Typically what it's for is actually protecting all of the nerves that ride underneath here if the collarbone gets fractured, okay? So that's usually what it's there for. The collarbone is the most commonly fractured, it's called a long bone. So it's the most commonly fractured long bone in the body. So this muscle has a very important protective job so that if this breaks, it's not going to shoot down and stab an artery or a nerve. Aside from that though, its motion of pulling down is going to be a limiting factor in some cases where you try to get that overhead range of motion if it's very tight. So if you're working with an athlete, an overhead athlete, and they're having end range pain in shoulder abduction or flexion, meaning this last little bit, I see a lot with people who are locking out overhead for a clean and jerk, or people doing snatches, and they're trying to really get that lockout. If their subclavius is really tight and they're having a lot of tension through there, that can limit that motion because it's going to try to pull the shoulder down. So clinical pearl, always check the subclavius for end range issues. If it is a problem, get in there with some AccuNeedles or something else like that to release it and see if it makes a difference for your patients. Hopefully everybody's doing well so far. I know it's a lot of info, but do try your best to keep up, and you can view it afterwards. I can't really see any comments or anything, so I'm going to assume everything's gravy otherwise. The mid-back. So the mid-back is called the thoracic spine. Very, very important structure because as you can see, the shoulder blade sits on the mid-back, okay? So you need to have sufficient range of motion in your thoracic spine to allow your shoulder blade to do what it has to do. The main things we're looking for here is extension and rotation of the thoracic spine. So extension is the process of this, and rotation is going to be side-to-side movements. Why that's so important is because if you try to bring your arm up and your thoracic spine is like this and it's not extending, that arm is going to not want to go up overhead unless you start to arch really heavily in your lower back as a compensation. So sometimes you'll see people lifting weights or even just doing daily activities, maybe putting something away at a shelf that's up high, and they'll do this kind of bend where they have to compensate by bending really forward through their lower back because what's happening is their thoracic spine extension might be quite limited. So it's always important to make sure that your thoracic spine is moving well to help with your shoulder ranges of motion. A couple muscles I'd like to highlight here. The serratus anterior. I had mentioned it a little bit earlier, and it is this muscle that sits along the rib cage. Now, what I'm going to do here is try to share my other screen again. Let's see. Okay, and now we should see this skeleton again. And what we're going to do is we're going to start to add on some muscle layers until we hit our serratus anterior. And I'm going to isolate that for you guys. So this is a very important muscle. It sits along the rib cage, as you can see here, and it travels all the way to the utmost inside corner of the shoulder blade. So sometimes people come in and like, I got this like nagging pain, like right on the inside of my shoulder blade. It can be a serratus anterior issue. But this orientation allows for this muscle to have a very important movement on the shoulder blade. It's going to help with protraction, which we didn't discuss before, but it's a range of motion of bringing the arm forward. So as this muscle contracts, that shoulder blade is going to rotate around the rotator, or around the rib cage, sorry. And it has a really important job as well of up rotating the shoulder blade. So we talked before with that scapulohumeral rhythm. As that arm comes up, that socket needs to rotate with it at the same time. So this serratus muscle is going to pull down on the corner of this shoulder blade and tilt this upwards so that it can track properly with the arm. So very, very important muscle when we start to talk about pain conditions and movement conditions at the shoulder. What's going on here? Okay, should be back to the PowerPoint now. So that's basically the serratus anterior. The next one we're going to go through is the latissimus dorsi. Just call it the lats. It's a very common name for it. As you can see off the lats, they start in the mid-back and they travel all the way down almost to your tailbone, okay? And they're a huge, huge muscle. It's going to travel the entire span of your back, and it actually inserts on the kind of anterior, the front inside portion of your arm in a little space called the bicipital groove, because that's a little spot right on the front of the arm, and the biceps is actually going to lie right over top of that. So because of its orientation, this muscle is going to help with adduction, which again is the motion of bringing the arm towards the body, extension, bringing the arm back behind the body, and internal rotation. So if you imagine that this muscle is contracting, this arm itself is going to turn inward. That's called medial or internal rotation. It's often thought of a pulling muscle. So people who are doing a lot of pull-ups, this is a very important muscle for them. But this has a very, very important role as well that we haven't talked about, which is actually depressing the arm, or in layman's terms, pulling it down. So you can imagine if this muscle contracts and it pulls, this head is going to pull down. Now, this is a very important biomechanical event because that allows that ball and socket joint to be nice and centered. That's a process called centration. So imagine my lats weren't active in pulling that down. What's going to happen is this head can drift up and hit that bony part, which can lead to pinching, okay? So it's really important that that lat is active in putting that head in the middle of that socket so that all of the other muscles around there can work efficiently. As soon as that changes position, the muscles around there are like, whoa, 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 we only like to work in this position. We don't want to work up here, or we can't efficiently work in this position. And that's where we start to get repetitive strain injuries as well. Hopefully we're all doing good. Now is kind of the fun part, now that we've kind of got through all the anatomy stuff. Very, very important, but I do understand it's a little dull sometimes. First thing to talk about, mobility versus flexibility. And this is something I often quiz my patients on. Mobility itself is the amount of controllable motion across a joint that one possesses. Very different than flexibility. It's a combination, of flexibility and strength. So you could be flexible as all hell, but if you don't have the actual strength to hold your arm or hold your hip in that position, you have terrible mobility. So if passively, meaning if I can bring my arm up here without actually activating any muscles, but then I can't hold it there, that becomes a problem. So you need to have control over the movement to have true mobility. And the converse is also applied, where you have a lot of strength, but you can't get the flexibility. So maybe you're super strong, but you can't move your arm above here. Again, poor mobility. So it's interesting because a lot of times we train for mobility in passive conditions. We'll hold a hamstring stretch. We'll hold a lat stretch. We'll do all these different kinds of stretches that are passively positioning us, meaning that we're just hanging off of everything, but we're not actually working on the strength component. We're just getting the flexibility component. So, this is really interesting to me because, yeah, the static stretching is going to give you some improvement, temporary improvement in ranges of motion or flexibility, but is it true mobility gains? Not really, because you're not going to have muscular control over those newfound ranges. The other thing to consider too is injuries at this point in time. So your muscles like to work within this range. Now, let's say you stretch out and you have this range. Your muscles have never really worked in this range before. So this is kind of unknown territory for them because they like to work in this range, right? So if you've stretched and you have that much range of motion, and now all of a sudden you go to do a CrossFit workout or some sort of other training, now what's happened is you've increased that window of range without actually having strength in that position. And now that, again, sets us up for injury. So something to think about. So how do we maintain healthy ranges of motion? Arm circles. Do you guys remember those from elementary school, high school, track warm up? You do like arm circles, 10 this way, 10 that way, and you get really, really big, and then kids were flinging their arms around like crazy. I certainly did. And that's not too far off. You know, they actually are onto something with that. So your gym coach back in grade 6 or 7 was actually, you know, not as annoying as you might have thought they were. So controlled articular rotations, that's a term from a course that I've taken. And what it essentially means is that you are intentfully moving the joint around its entire range of motion to fire up all the receptors in that joint. So every joint, let's revisit our ball and socket. Inside that socket are a bunch of little light bulbs. Think of those as the receptors. Every time you move and hit those light bulbs, little signals are going to go off to the muscles, telling them how to respond and telling them how to move. So it's really important that we utilize that full range of motion rather than just a little bit. So working on these controlled rotations is really a nice way that you can help maintain a healthy joint ranges of motion. Now, these are an assessment tool, and they are a tool that you can use to maintain ranges of motion, but it is not something that you're going to look to improve your range of motion with, because for that, you're going to need to start to look at isometric loading. You're going to need to load up that joint like we talked about before. So, you know, one of my supervisors, and I think Chad's in here too, if I recall correctly, one of our supervisors that we had in placement, his name was Dr. Howitt, and he always said, you know, a test is an exercise and an exercise is a test. So when we think about that, you have to be able to perform efficiently, and then both apply. So if you're doing this as a test, it's also an exercise. And if you're doing it as an exercise, it's also going to give you feedback about what you need to improve. So think about these things when you're doing these kind of positions. So again, those are our controlled rotations. So I'm going to show you a quick little video here, okay?
I'm Dr. Andrea Spina, and we're at the Onnit Academy in Austin, Texas. I'm here with Cameron, and today we're discussing how to maintain healthy joints. And if you look at the research, one thing that's clear is the only way that you can maintain your joints through time and keep them healthy is by constant movement. The more you move, the more your joints receive nutrients from the blood, the more the cartilage maintains its composure and its integrity, and the healthier your joints are. So with my clients, what I recommend is what we call a morning routine, where they get up and they sequentially go through every one of their joints and they move those joints to their maximum end range of motion in a rotational fashion. It's something called a controlled articular rotation. I'm going to show you the controlled articular rotation for the femoral joint or the shoulder joint on camera. First, things that way. What we're going to do, I'm facing forward. I want him to solidify the rest of his body. So I want him to kind of tense up his whole body so that all of the motion comes out of that shoulder joint specifically. So from here, thumb facing forward, I'm going to get him to come up into forward flexion. And as he raises up into forward flexion, there's going to be a spot right in about there where it becomes difficult to get any further. At that spot, I'm going to get him to try to reach up, and then we're going to actually rotate that shoulder. And we're going to try to drop down, staying in the same movement line all the way down until the hip, or until the arm meets back at the hip. So what we're trying to do is from here, we go up as high as we can. As soon as we get to our highest point, actually rotate, and then we're going to come all the way back down and around. If we do this from the front, what you should see is that the arm stays in the same movement plane. So we're going back here, we rotate. I should be roughly in the same position. What you'll see is a lot of people with a little less healthy shoulders, as they start to rotate, that shoulder is going to come out that way. And that would indicate a less than healthy shoulder. You should be doing this exercise a bit more. But from here, we're going to come forward. We're going to bring that arm all the way up until we maximally forward flex. From there, I'm going to get him to spiral that arm around, and then we're going to try our best to keep it in the same movement plane as he comes back around. One thing you can do to test yourself, if you're standing beside a wall with your shoulder touching the wall, really healthy shoulder, you should be able to clear the entire wall without having to move yourself out. The less healthy that shoulder is in this position, the more you're going to have to kind of step out and literally rotate your arm trailing off to the side.
So a couple really, really good points there. When Guy Cameron there was doing his range of motion, we were trying to make sure that he wasn't going out to the side at all. As Dr. Spina here pointed out, that a lot of people tend to come up and then they're going to drift out to the side because they don't have that rotational capacity. So you almost want to imagine that there's a straight line and they're trying to keep within that straight line all the way back and not have that arm come out to the side. So if someone's having a really challenging time doing this, using like a wall or something along that, like he did, is a really, really great tool. So again, that was a controlled rotation, something really helpful for maintaining healthy joint ranges of motion.
I'm Dr. Andrew Spina, and
so now we're going to take a look at the same thing, but applied to the scapula, so the shoulder blade. So that was, this one here around is specific for the ball and socket joint, but this can also be applied to really any other joint in the body. And this is a good one. This guy does a really good job of isolating the shoulder blade here. Disclaimer. I don't know.
Hey, it's Jason from Kinetic Sports Rehab. I'm here to talk to you today about tall, brace your core, and start with your hands at your sides. You're going to elevate your shoulders up, pull your shoulder blades back, drive them down into your back pockets, and then slide them forward. Trying to make the largest boxes that you can.
What he means by making the largest box is that imagine you have like a little point on the end of your shoulder here. As you do that ranges of motion, you should be trying to draw a big circle or a big box imaginatively with the outside of your shoulder to really emphasize that full range of motion.
Common compensations that we see, the head might want to come forward. Don't let that happen. The ribs might want to elevate up. Again, don't let that happen. And the elbows might want to bend. So we're trying to keep all those three things from happening as we perform this motion as slowly and as controlled as we can. You want to go both that way and then reverse the movement as well.
So he does a really good point of demonstrating these controlled rotations at the shoulder blade itself. A lot of people get nervous when they go into that forward position. So working on that scapula car, going forward into a protracted position, people get nervous about that because they're always told, you know, they've probably seen somebody who said, you got to make sure that you're in this nice militant posture all the time. There's no such thing as the perfect posture, and this is no exception. So you need to make sure you're training the joint in all directions, because when you do certain movements in terms of weightlifting or just activities of daily living, you're not going to be able to hold that perfect posture every single time, and nor should you. So don't worry too much about letting the shoulders round forward when you are doing this. It's going to cut me off, I guess. Okay, well, let's try to zoom through the rest here. No pun intended. This is a controlled rotation I was working on with an absolute unit of an athlete that I work with named Adam. Adam came third at Wodapalooza this year in the RX men's division. This is for the mid-back, so we're just working on some rotations for his mid-back here. Okay, so acquiring new range. How are we going to acquire new range? We've talked about that you can use these controlled rotations for maintaining the range of motion that you have, but how are we actually going to get more range itself? Sorry guys, 1 second here. Oh, they removed the time limit. Okay, great. Yes, Mark, an absolute unit he is. Okay, sorry about that, guys. It looks like Zoom's gonna let me go over the limit here, which is great. Okay, so how are we gonna acquire new range? So stretches and isometric loading combined, okay? That's how we're going to get new range, okay? So it's not just stretching alone. It's actually pairing that with activation of the muscles to control a range of motion, okay? So here, I'm gonna show you an example of what this would be for the hamstring. Again, the same course I've taken, they call this pails and rails, progressive and regressive isometric loading. What you're trying to do essentially, so an isometric contraction would be a bicep curl. So if I'm contracting my bicep, but there's no movement actually happening, the muscle's engaged, but the length of it is not changing. I'm not lengthening it and I'm not shortening it. So that's an isometric contraction where you're, think about like a wall sit or something like that, where you're maintaining a contraction, but you're not changing the length of the tissue. So what we're trying to do here with these pails and rails is actually work on increasing the range, but then also implementing strength training at the same time. So going back to our definition of mobility, mobility is a combination of flexibility and strength. So we're trying to work on getting that flexibility, but then reinforcing that right away and backing that up with strength to actually impart control over that new range of motion. So this is one that we did for the hamstrings.
Sitting on the ground, just like so. First thing we're gonna do is try to lift your hips up and scoot that hip backwards.
The reason why we're doing that is because that's going to put extra tension on the hamstrings by scooting the hip back. It's going to help load up the hamstrings right away.
Sit down, you should already start to feel some tension building up in those hamstrings. You're going to lean your abdomen over that leg, keeping a straight back until you feel tension building up. From here, what we're going to do is drive our heel down into the ground.
So that heel drive into the ground is that isometric loading. So we have now found a position, or I have here in this video, where my hamstrings are feeling a stretch. So I'm actively getting some more range in my hamstrings, or passively, sorry. And now we're going to actively reinforce that by driving the heel down to actually activate the muscles in that position. So range of motion was here. We've pushed it to here. And now we're going to work the muscles in this position so that they can have control in that whole range, that newfound range.
Down, and we're gonna hold that at about 50% of what you think your maximum is. We're gonna hold that for about 10 seconds, and we're slowly gonna relax. Staying in this position, we are going to try to lift our leg up off the ground, holding anywhere from 5 to 10 seconds, keeping the leg straight and not swaying back too far, using our core and our hip flexors, and then we're going to relax.
So driving the heel down is our progressive range of motion, and pulling up is our regressive. Think of it just as forward and backward. You're just trying to train both sides of the joint. So if this is the ball and socket joint, you want to train the muscles here and here to help reinforce stability for that joint, okay?
Hey everybody.
So again, active range versus passive range. Picture A at the top here. This individual here is doing an active straight leg raise, meaning they're raising their leg up into the air, keeping it nice and straight with their own muscles, okay? So active range of motion is the amount of movement created by muscular contractions around a joint. Very different than passive range of motion. Excuse me. So passive range of motion itself is how much a joint can move in the absence of muscular contraction. So if I was lifting the leg up like the gentleman in the photo here, or you were using a wall to assist you or some sort of other device. The ideal situation is that your active range equals your passive range, okay? But I guess my question for you then, just to think about, is what's going to happen when this active range is less than our passive range of motion? That's what ROM is, sorry, range of motion. So what happens when the active, meaning how much we can move it, is less than the passive, meaning how much can it be moved without our muscles, without our muscular control? So like I said, we always want active. Sorry, this is saying, what it's saying here is when there is a gap, so a difference between those, the active range is always going to be less than the passive, okay? But we really want active to equal our passive range. So on this picture here, the gray, the first little arrow here represents our active range, kind of what I did here before, meaning we can move it this far on our own, but if we had someone do it for us, we could get all the way to the pink, okay? We want those two bars to be equal. So it means that you have full control over the entire range of motion that a joint possesses. So think about a gap forming. So for instance, if actively you can only get your arm to here, but passively I can move it to here, then that window here, that's injury city. So that's where you're going to start to look at getting injured or having a greater likelihood of getting injured in that range, because again, your muscles don't exactly have the control to work in that position. So reducing the gap is really important to reduce injury risk, improve your mechanical efficiency and performance, because it means that everything's going to be working as it should in the position, as opposed to compensating in some way, shape, or form. So how are we going to reinforce our ranges of motion? So let's say we've done our rotations, we've done our pails and rails, we're feeling good, we've maintained our healthy range, we found a range that was limited and we worked on getting that greater, and now our active and passive range is looking good. How can we continue to improve or continue to build strength and support our joints? 3 different things, and we get into passive range holds, liftoffs, and hovers. And these are all kind of graduated versions of what we had talked about previously. So I'm going to, again, show you a little video here. And this one's going to be specific for the shoulder.
We're going to use a PVC pipe to lift our arms up off the ground, working on that overhead shoulder stability and mobility. So, really important with this one is that the wider your grip is, the easier it should be. The narrower your grip is, the harder it will be. Ideally, we want to try to inch our way in,
Let's get
fully
to the
work
good
our
stuff
way
here.
in to getting in.
Blah, blah,
So
blah.
we'll go for a
Blah, blah,
position,
blah. Okay.
feet squeeze together, glutes.
You want to create tension through your entire body here. So you want your glutes to be active. You want to be pressing your ribs down into the ground. Your lower back shouldn't be arching. You should be squeezing your feet and your toes together. So you're trying to create as much tension throughout your entire body as possible, so that when you do this lift off, you're only moving as much as possible through the shoulder joint and not wasting energy going through everywhere else and compensating, okay?
Chest and rib cage press down into the ground. We're going to squeeze that PVC and we're going to lift.
So basically in a face down position with the arms overhead, you're basically at 180 degrees maximal shoulder flexion, okay? So what we're trying to do here, that's my end range of motion in terms of passive range. So what I'm trying to do now is actively lift off to help work on end range stability to control that joint better, okay? What you can also do in this position, you could even take a yoga block or a couple weight plates or something and place them underneath the arms, okay? So let's say that you want to make this even more challenging. Like I said, take the yoga block, place it under the arm in this position so that you're already even further back than you would be on the ground, so that when you try to lift off, it makes it that much more challenging for you. So these are all tools and tricks that you can use to actually work on improving your end range control once you've made sure that your range of motion is normal, okay? So this is something you would do after everything else that we've talked about already. And this is an example of a hover.
So here we have the final and most challenging.
I'm gonna mute that. So what we're doing here is, again, we're working on that lift off. So I have a lacrosse ball in my hand, tension through the whole body, lifting up off the ground. And now what we're gonna do is actually hover over an obstacle here of a certain height. Why? Because that's going to challenge our end range control in this position, but also all the way around. So we're starting to combine things. So we're starting to look at combining our controlled rotations with our muscular contractions to work on that entire range of motion. And this basically just goes through the full range that the shoulder should. Again, this should look similar to that rotation we looked at earlier. And then we're just going to go back over the blocks to the starting position and down. So this would be a more challenging progression that you can use to work on that end range control. Hopefully we're all doing okay so far, guys. We're getting towards the end as well. So rehab extras. We mentioned 2 muscles earlier, and I want to go over some rehab specifically for those muscles because they're clinically the ones that I usually dive to first with a shoulder problem along like the core, like I had mentioned before. So that's serratus anterior muscle. Again, it's the one that sits on the inside and travels around the back to the shoulder blade. And a common clinical finding is that people have really poor control over their shoulder blades in up rotation and protraction. So again, revisiting that ball and socket joint, it needs to rotate up like this. That serratus anterior is the one that's going to assist with that motion. And a lot of times clinically, people have a really challenging time doing that. So what we need to do here is actually look at getting their serratus active. And for me, a progression of exercises that I use in clinic, we start with supine serratus punches, which is when they're laying on their back and just working on that protraction movement. Then we get into serratus push-ups, which I'll show, wall slides, and stability ball wall circles, which I'll kind of go through all those with you guys here. So this is an example of a serratus push-up. So you're going to notice my elbows are staying very, very straight the entire time. All I'm doing is moving my chest down to the ground and pushing away. So retraction and protraction. So moving from this position to this position, to this position, to this position. If it's too challenging for someone to do it in a plank position, get them up against a wall or get them up against a counter to induce some forward motion. This is a really great movement that can be done to actually get that serratus anterior moving really, really well. A lot of patients I have with shoulder problems who do this exercise, they do it before their activities, or if they're in the middle of like a group fitness class and their shoulder starts to hurt, maybe they'll do this in the middle of the class and then they always say, oh, my shoulder feels really good, so I just do that when I have to. Maybe it's just an issue with that serratus anterior with that upward rotation. Either way, it seems to be something that people really like. This first video here is a wall slide. So this is the next progression for that serratus anterior. So what we're going to do here is take a resistance band and place it around the wrists so that you're holding this position. I don't want to see diving in. So you're trying to externally rotate and hold that position there. And what we're going to do is slide up the wall, keeping that position. So again, working on that upward movement of your scapula, of your rotator, of your, your shoulder blade. So this is a really good exercise as well that I progress to for somebody after doing some of those serratus push-ups when they've gotten control over that movement. And finally, the kind of hardest version of us
For this exercise, you want to start.
serratus anterior exercise I'll give somebody is this wall circle. So taking a soccer ball or a stability ball, gym ball, anything, pressing it into the wall. So again, that protraction movement. And what we're trying to do here is once we've worked on protracting and holding that, engaging that muscle, we're going to try to do some dynamic movements. So clockwise, counterclockwise circles to challenge that muscle to stay active and stay firing in a dynamic position so that they can control it in a static position, meaning not moving, and dynamic, meaning moving. So those are some exercises I really, really like for the serratus anterior. The lats, again, a muscle we talked about before. It's primarily a pulling muscle, plays a massive role in posterior, back, and lateral side trunk stability during weightlifting. It is essentially part of the back core, if you will, has a really, really important job of stabilizing their entire torso. So how do we assess for this? Because a lot of times people present with tightness when they go up overhead, or a limiting factor for overhead mobility can be tightness in the lats. So a really nice way, and Dr. Aaron Horschig here from Squat University does this really, really well, is a seated arm to overhead against a wall test. Sorry, I just butchered that name. I don't know what you want to call it. Let's just call it an overhead mobility test. You can either do this with or without a PVC or a dowel like he has here. And what we're trying to do here, I'll just let him explain. Hold on.
Now we're going to sit by a wall, cross-legged, and I want your back semi-flat against the wall. It doesn't have to be perfectly flat. You don't have to tuck your pelvis under, but you're going to be in a good position like this, shoulders back. We're going to start in that firm rack position. Remember, they're not too close. We're going to be a little bit wider, palms down. Now in this position, I'm internally rotated, and I want you to see how far can you go back towards the wall. Now you can see in this position, I'm pretty close without my back having to pop off the wall and over arch. So I want to keep my back fairly close to the wall. How high can I go? So I'm close to the wall, but not great. Now what we're going to do is externally rotate the arm. So we're going to turn our palms up. What is this doing? It's putting a stretch on the lats. So if the lats are stiff and tight, it's not going to allow me to get nearly as far as it was the other way. So in this position, I'm now going to go
That's about the end range I have right there. So you can see there's a difference when I externally rotated my shoulders, put a stretch on the lats. Now I can't get nearly as high. Now, what I'm going to show you guys are 3 different.
And then he has some decent drills to work on that. But what you see here is something really, really important, is that difference between the internal and external rotation. So remember, the lats are going to bring the arm down like a pull-up, and they're also going to internally rotate. So like he was saying, if we do this test and externally rotate and they can't get as high, tells us there's some tension in through the lats that should be addressed. So how do we do this? Manual therapy, whether that's some sort of soft tissue work, acupuncture, again, maybe doing some foam rolling. I'm not a big fan of foam rolling, but for this, it could be something helpful that a patient can do or an individual could do at home. And then pails and rails for overhead mobility. So we talked before that if you have deficient or aberrant range of motion, you don't have as much as you need, the controlled rotations aren't necessarily going to do you much good, because that's just going to work on maintaining the range that you have. What we need to do now is start to work on those isometric loading patterns. So not only just doing the arm circles and doing the overhead work, but also engaging the muscles in progressive and regressive ways. So a really, really nice drill I'm going to show you guys here. I use this one a lot with patients. So the patient here, the individual, is going to be holding a dowel or a broomstick, okay? And what they're going to be doing is engaging their core. So their core the entire time is like a hollow body, so they're really thinking about pulling that core in. Their glutes are going to be engaged. I would like to see a foam block or something, or a ball between the knees that they could squeeze as well, just trying to create as much tension throughout the body as humanly possible, okay? And now, so what this gentleman's going to do here is he is going to lean forward. So he's getting to that end range position here. And he's going to lean forward until he feels that he can't go any further, okay? Till he's hit the end range of his motion. Now what he's going to do is he is going to drive that stick downward. Like he's going to push with all of his might. So he's in this position. He's going to push, 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 push. Almost like the air is super, super thick and he's trying to get all the way down. This should be very, very fatiguing. And he's probably going to hold this for up to a minute, maybe even 2 minutes if there's a really big deficit in the range of motion. That's our isometric loading in our progressive direction. So he's worked on pushing down and he's worked on isometrically contracting. So he's really push, 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 getting those lats and getting those muscles fired. And now what he's going to do after he's done that is train the opposite side of the joint, like we want to make sure that we do. So what he's going to do is he's going to stay in that same position and he's going to lift up off the ground. So right now he's driving down, still driving down, and now he's going to think about lifting that stick up off the ground there. And that's really going to help train the opposite side of the joint. So he's just worked on pushing down and lifting up, and that itself is going to train both sides, which then should theoretically give him more range of motion. And he's going to repeat this until he hits his target goal, or maybe it's a side-to-side difference that they're trying to normalize. So this is something that I think is a really, really nice drill for people to do who are having issues with overhead mobility due to lat tightness. So we're nearing the end here. This is just another clinical pearl for any of the healthcare providers watching this. It's very, very important that you distinguish between mechanical tension and neurological tightness. Two very, very different things. If you're a trainer or a coach or something and you're working with somebody for tightness and you just do the rotations and the pails and rails and all the good stuff we talked about. Clinically though, it's very, very important to distinguish mechanical tension from neurological tightness, because a lot of times people come in, I had this stiff neck or this stiff shoulder for forever and ever, and I've seen people for all the soft tissue, manual therapy, voodoo flossing work in the world, but it's not getting better. And the reason being is because it's probably neurological tightness. It's probably not mechanical. So the distinguishing factor is that mechanical tension is a fibrotic development that's going to develop between the layers and within the muscle layers themselves. And this needs to be assessed for when you palpate, when you touch, combined with movement. So if you just touch and it feels tense and tight, that's not mechanical tension. Mechanical tension you need to evaluate for with range of motion and find those points that are very, very tight. That itself is tension, okay? Neurological tightness itself is an increased neural drive to the muscle, causing guarding and a reduced range of motion. This you're going to notice at rest as well as palpation during movement. So if you just go to touch, like you'll get this a lot in the subscapularis or other muscles kind of into the rotator cuff, where if you just touch and they haven't even moved their arm and you feel like a really, really stiff, really, really tight muscle that's guarding and spasmed and not letting you move, no matter how much you dig in there and try to stretch it out, it's probably not going to budge. And the reason being is because it's not mechanical. If you can feel that tension and perceive that tightness without there being any range of motion, it's probably neurological, which means that you need to apply a neurological based intervention, meaning you need to get the nerves working in order to actually get that muscle behaving the way it should. So pressing and stretching and doing all of your soft tissue work isn't going to get you to where you need to be. So things like acupuncture are great. The pails and rails are fantastic because what you're doing is teaching the nervous system that that range of motion's okay, and you're firing the muscle in its contracted and its lengthened state to allow it to function properly. So a summary, key points: understand your relevant anatomy and mechanics. If you can understand the anatomy, then you can create your own mobility drills to your heart's content based off what you objectively find. So, you don't always have to look for a specific movement. It's not always a certain movement for a certain problem. If you're moving your arm and you find that your internal rotation is limited, you can apply the same concepts of internal rotation and do your isometric loading in progressive and regressive angles to try to improve that range of motion further. So anatomy is the bread and butter here. If you don't know your anatomy, that's going to be a problem. Second thing is that mobility is a combination of flexibility and strength or muscular control. It's not just passively acquired. You need to work for mobility. A lot of people think mobility work should be like easy peasy, no problem stuff. You should be sweating. Like you should be dressing like you're going to go to the gym. Like a lot of people come into the office for treatments and we're working on mobility and they show up in like jeans and like skinny jeans and a t-shirt. And I'm like, okay, we got to get you to change because you're going to be sweating. And they're like, well, we're just doing mobility work. It's like, yeah, you'll see. And then they do. And then they never forget their workout clothes again. And then increases in joint range of motion need to be reinforced with muscular control across that joint. Otherwise, it's temporary and you're not going to get any long-standing change. So that's pretty much it. Thank you very much for listening to me ramble for about 54 minutes. Really, really appreciate that. Shameless plug for all my stuff here: Instagram, email, and the World Wide Web. You can always look at those. And I'm going to stick on here for a little bit and do a Q&A. If you have to leave or you don't want to stick around, thank you very much. Really, really appreciate your time and attention. But if you have questions, turn on the camera, let's chat, and let's go over them.
Hey, Carl.
Hey, Natalie.
I have a question. So, I have like really bad shoulders, and like, had a car accident like a few years ago, and then went to physio and all that kind of stuff. And I learned a lot of those, like, those exercises we were talking about, but I still find that I have a lot of issues with overhead work and also, like sleeping positions. And it doesn't matter how much I stretch them out or how many times I do those exercises, I always find that when I wake up, I still have the same problem again with the tightness in the shoulders and, at LP with the overhead, anything overhead, basically.
Okay. You were doing exercises like we had went over there, like where you're actually working on improving the isometric like loading. Like it's not just static stretching; it's actual engagement of the muscles.
Yeah, like the cars with the, being against the wall and doing those kind of like circles and that kind of stuff. Yeah. And also stretches, and like it helped a lot, but it didn't eliminate that kind of recurring.
Right.
And I don't know if it's from like the overhead stuff or like from sleeping, because I really find that the sleeping positions, and I've tried like different positions, but I find that it just kind of comes back again.
Right. I'm gonna ask that if you want to message me privately after, so we can chat a little bit more. I just don't want to discuss
Okay.
too much like personal specifics over the webinar, just for confidentiality and privacy reasons.
Okay.
So if
Cool.
you, Natalie, if you want to send me a message later, let's talk and let's kind of see what you have done and what you haven't done. But I'll just try to keep the questions here specific to the material rather than like personal issues, just so we don't start having an issue with like individual privacy and like confidentiality.
Cool.
If that's okay.
Yeah, so I'll just email you then.
Yeah, you can email me and we can talk further and look at setting something up.
Okay, thank you.
No problem. Thank you. I think there's some stuff in the chat here. Hold on. I'm not good with Zoom. I do apologize. Where's my chat? Stop sharing. Okay, thank you guys. I'm going to assume that nobody else has any other questions at this point in time. If you do, send me an email. What I will ask, I'm going to be sending you guys an email as well to follow up after. And then I'll put a link. I'm assuming I can get a link for this a recorded version that you guys can watch. And then if you guys want to provide any feedback, I really appreciate that, positive or negative. It always helps. I'm hoping to do more of these webinars moving forward, considering the work from home status is still a go for quite a while. So hopefully we can do more of these. And again, thank you to everybody who tuned in. Really appreciate your time and attention. And then stay well, and hopefully we see you guys in the future. Thanks, guys.